My name is Dr. Rebecca Omokaru Okolo. I'm the founder of HealthThenMore and the co-founder of Progeny Cerebral Mentorship Program. I started HealthThenMore in 2015. It's an online community for health professionals from all parts of the world. Volunteering. I think I've asked you to unmute. All right. Do you want to start the video? You don't have to go on video if you don't want to, but you can.
I know I'm on the video, so it was okay.
I can see her.
I want to understand, what do you want me to do?
All right. So this is the question for the second case, right? At your last
for the first one, we jumped the first one. A 42-year-old male.
Yeah, the 42-year-old male, Adam Jensen, presents to the ER via ambulance. He is intubated, ventilated, and comatose. Paramedics were called to the scene after he had a seizure. His pupils are fixed and dilated. CT scan shows a major intracerebral hemorrhage. His wife is in the waiting area and wants an update on his condition. So that's like someone's wife wants an update on his condition. Look at all that's happened to him.
Oh, okay. So you want me to approach the lady and give her?
Yeah,
okay.
She wants to know, doctor, what are you going to like? What's going on? So Dr. will be your...
I move on to her first, and I move to her. I walk up to her.
Hold on. No, you're not going to discuss it. I'll give you 10 minutes to actually...
Oh, okay. Then I'll tell you what I'm going to do.
I'll be your SP. Then you will talk to me.
Okay, that's fine.
Okay.
That's fine.
And which of the exams are you preparing for?
Actually, I'm preparing for Key 1.
Okay.
Yeah, I just ticked OSCE because I intend to do the OSCE 2 as well.
Okay.
Well, I'm just preparing for Key 1. Well,
okay.
It's okay.
Yeah, it's just the timing. Okay, Becky.
So I'll give it, it's going to be 10 minutes. Let's just 10 minutes.
Okay,
so
that's fine.
The times
you have to give her 2 minutes to prepare her thoughts, right?
2 minutes will be, everything is included. You know, it's 2 minutes outside, 8 minutes in the station, right?
Yes. So we'll be giving you 2 minutes to prepare your thoughts, and
so I'll give you 2 minutes to prepare. I'll tell you when it's time to start.
Okay.
okay. Becky, so you can start timing now.
Start.
Okay.
Okay.
Hello, madam. I am
Hello, doctor.
Okay, I'm Dr. So. I am here. I want to give you an update on your husband, Mr. Adam.
Okay. Doctor, please, can you just tell me what's going on with my husband? I'm so agitated. I'm scared. I'm worried. I don't know what's going on, please.
Okay. I know how you feel, madam. And currently, your husband is he's being stabilized. We had to take over his respiration because of the seizure that occurred at home, and we've had him. He's being ventilated, and we are giving him oxygen to support his breathing. And
Oh my God, is he going to be fine? What do you mean by ventilated, all these things?
yeah.
Please, can I see him? I really want to see him. Can
Okay.
I see him?
Okay, correct. Currently, madam, you will see him, but not at this moment because now we
Oh
have
my
he's
God.
not speaking. We have to take over his breathing for him. He's on oxygen. He has tubes, so he cannot speak to you at this moment.
Okay, but can I just see him? And is he going to talk at some point? Why
Uh,
is he not speaking? What is going on? We were
okay,
just together talking and the seizures just suddenly started. What could have, oh my goodness, doctor,
okay,
I'm worried.
okay, madam. We are currently running some investigations on him, and we had a CT scan that showed he had a bleed in his brain. So now we're trying to.
Oh God, God.
Okay, actually, he bled in his brain. We have the seizures are stopped for now, and he's in a sleeping state. And for now, so we're rehydrating him and giving him everything to make the brain rested. Then at some point, we expect him to get better. We had investigations done that already showed that he bled in his brain, and for now, I think he just needs to be rested. And I assure you, you need to calm down and you'll be fine, and you'll get to see him at some point.
Okay, thank you very much, doctor.
Yeah. You're welcome, madam.
You still have 7 minutes to go.
And this
Yeah,
is
maybe
my
she finished quick.
medication.
Okay, all right.
I
Feedback.
don't know. It's been a long time. I've not practiced like almost 4 years.
No, no, no. I mean,
It's okay.
yeah, I think you did well. I mean, I think you did pretty well.
Thank
I
you.
mean, maybe I'm going first anyway, so I'm sure uh, my guys that are here will be able to drill more hole. Like, to be honest, I mean, I like your tone of voice. See, whenever you have OSCE like this, there is always a tone. I think we should kind of see ourselves as actors, honestly, because yes, we are doctors, but we're actors. You can come out of your house having had issue with your wife, having had issue with your husband, having had maybe a motor vehicle accident, you get something serious. But suddenly you're seeing a patient who just had a baby. What are you supposed to do? Your tone is supposed to go up, reactive to what is happening. You understand what I mean? And this is workplace. This is what is sort of expected. If your tone is somehow, patients will feel like this doctor is hostile. So that's how OSCE is, because you're changing from different room to room. This room is full of excitement. That room is full of sadness. So your tone has to be reactive to what is going on. And that's your mental state examination for patients. If your tone is not reactive, that means even you are having a psychological problem. So your tone was very reactive. Do you
Thank
understand? It
you.
was like in the tone of what was happening, like something bad was happening, like you were trying to control the situation, trying to make her understand, trying to make her feel like you guys are putting everything under control. You're, as much as possible, trying to make sure that the husband is okay. And you're trying to make her feel calm. I mean, did you do very, very well? Not really, in the sense that, in the sense that some of the remarks that you made, could be better. And I will leave them to do that. I'm very sure that they already have all those holes that they're going to tell you. Do you understand? So the issue will now be the remarks, talking, saying some things that you're not supposed to say, also understanding the situation better, and not putting yourself in a hole.
Lying.
I mean, for this that happened, I will leave them to punch a hole in everything you did. but I think that your tone was good. And, you know, as a lady, ladies pretty do very well in OSCEs because, I don't know, you guys are just naturally kind of, you know what I mean? Sometimes when you're making mistakes, you know, the fact that your tone, your body language, we didn't see your face, but I believe that your body language.
No, I didn't close my face. I'm here.
Yeah. Yeah. So if you had seen your body language, I believe that would have been good because your body language is so important in this kind of situation. You know, the way you talk, the way you do this, yeah. I was with one of my nurses at a home, and we had this, you know, patient, very old patient, you know, 92-year-old, who, you know, was basically close to end of life. And some of these patients, when they're close to end of life, sometimes they come in and they come a bit out, and it seems like they're getting lucid. But reality is that they are, you know, slowly creeping towards that period. Now, you know, the relatives, some relatives kind of feel like maybe my nurses are not doing enough in the home, maybe this, maybe that. We might want to see the doctor, you know, talk to the doctor, what's happening, you know what I mean? And yeah, so this day I was there. I had gone to see the patient, and I was just rounding off with my nurse to say, okay, this is the plan, this is the plan, this is that. And then I heard that one of the relatives wanted to talk to me. It was something like this. This is real life, and I'm telling you, you know, something like this. And I was like, oh my God, what am I going to say now? I only just took over the care of this patient not too long ago. And then, you know, I just went into the room, you know, just like you talked, calm down to their level. You know, of course, you don't understand how they feel. You can only, you know, imagine. So you're just trying as much as possible to put everything in perspective and not nail yourself. I was being asked, you know, is it possible that he might be able to be in this position for like 24 hours to 3 days because we want someone to be able to come and pray for him. That's his last wish. What would be your response to this? You know, so you just has to be in that situation. You just have to like be in that acting position to make sure that what you're saying, if you're being told as a person, you're going to feel very happy about it. So, you know, I quickly took the guilt out of the relatives, and I told them, I was like, immediately I was already sensing guilt. So I'm like, during this period is so tough, and if I were in your shoes, you know, it might be, you know, I might be having a sense of guilt. But you know, having a sense of guilt is one of the hardest things when it comes to grieving. You're already in a position of grief right now, and you know, which means that it's a very tough position to get. So feeling guilty, you know, is one thing that you do not even want to do. And why? Because you don't even determine you don't determine the end of life of the patient. Do you understand what I mean? Like, you don't determine the end of life of the patient. End of life tends to come. Sometimes you don't predict it. It can just come. Some of these situations just come, and no one is able to predict. Even with our best plans to have things done just before the person dies, things like this happen. And I'm sure that even the patient who is, you know, in this position would probably understand if they were here, you know, saying that you have actually tried your best. So you see, I'm trying to diffuse the situation. I'm trying to take off the stress of that person, take off that burden, making that patient feel less guilty or not guilty about what is happening, because it could, you know, further worsen their situation. And already they are trying to transfer aggression on us, that maybe we didn't take care of the patient enough. That's why the patient couldn't wait for them to be able to do what they were thinking to do for the patient before the patient passes. Do you understand? So, I mean, this is just like, you know, what I just wanted to, you know, leave you with. I'm sure they'll punch a lot of hole into it and just let you see and that. But, you know, just putting things in perspective and knowing that it's your behavior, it's acting. And when we were done, you know, I mean, it's not pride or anything, but, you know, the nurse that was with me she was very, very happy. She was like, thank you, doctor. She still sent me a text. She was like, awesome job yesterday. You get, and it's not because I mean, it's not because I did any special diagnosis. I didn't, I didn't say, let's do let's start doing blood sugar. I was just like, okay, what is our goal of care for this patient? Do you get? If goal of care is allow natural death, why are we going to do CT scan? Nothing is going to happen. So this was what I was trying to just pull out to the patient to understand. Well, I mean, they will punch other holes. So my bottom line is that your behavior should be congruent with what is happening. You'll be thrown into a situation that none of these people will be able to have taught you before time. But by the time you analyze it and you go in trying to be of, like if I were in these shoes, how would I feel if doctor is speaking with me? Then you will see that by the time Dr. HealthThenMore teaches you a lot of these directives, behavior, how to move, how to talk, what not to say, you will now be able to apply it into any situation that she might not have covered. So I think our classes will be very good, will be important, will be necessary. Having had the experience herself, in fact, having done QE2 the second time, I remember we did the QE2 together, and I was just telling myself that I'm happy I did not over prepare for this exam. That's just all I told myself, that I'm happy I did not over prepare. That the people who over prepared will probably fail. I told looking at that, I just told myself that I just felt like my chances are, higher passing this exam because I just went naturally. To get so just naturally and apply those things. If you apply the things that she will be teaching you into every situation, I think that, you will do well. Thank you very much. If anyone is speaking, you have to unmute yourself. I think I'm done now. Thank you. You need to unmute yourself, Dr. HealthThenMore.
Oh, I'd forgotten I was on mute. Thank you. Okay, so Dr. Bukumi, please go on.
Okay, Dr. Ebimose, would you want to, because I was the SP, right? So.
Okay, like Dr. Empress, I'm really impressed with your boldness in handling this situation. You knew what was going on with the patient and you were not afraid of tackling it. And trust me, in the emergency room, when patients like this present to the hospital, every doctor wants the ground to open up to swallow it because you don't want to face the relations. They put pressure on the doctor. Many times they want miraculous intervention. And we all know that nothing really can be done for the patient. And many times it's very common. They want to put the blame on the doctor. They want to litigate the doctor, that the doctor is responsible, and it's not the doctor responsible for it. And at this point in time, you have to be direct, which you clearly did. Okay, so is there any other thing you want me to address, Bukumi?
Oh, thank you. That's fine. Okay. So, Dr. Empress, thank you very much. You did very well. I'm not really a good SP, but I really like the fact that you were calm and you were trying to explain things to me. But I think you did very well. It's really a difficult question and not quite a scenario that people are familiar with, but it comes in the exam. You know, when you came in, you should have told me your name. Maybe I would have felt a little bit better. You as well didn't ask for my name, right? Sometimes SPs are always agitated. They would all stand up all over you, you know. Your voice was calming, but maybe there are some other things I would have just expected you to hear to just sound a little bit reassuring, right? And I think Dr. Becky will talk more about some points. So there are some things that Dr. Becky will talk about, but somebody asked a question in the chat box that can we can we disclose patient's condition to wife from ethical point of view without knowing if she has the power of attorney? Then the other question is, sorry, do we have to check if she has the right to know the husband's status? And also, can we ask the patient history to the wife? So I think those are some of the things Dr. Becky will talk about. Or you want me to go ahead and just say some things?
Go ahead and say it.
Okay, so I think at the beginning, right, it is very important, the patient was agitated and all that. After introduction, you try to calm the patient and you want to know, because this is the wife to somebody that just had seizures and the person has a bleed, right? So you really want to see how the person is doing. How are you? I understand that you are a bit agitated. Don't worry, I just want to assure you that these are the steps we have taken. So mentioning that, oh, the patient has been intubated, ventilated, and you can explain it, because this is 8 minutes station. So just explain that, it was brought in, and what we've done is probably we've passed pipe through his throat so that he could probably breathe, and so you have to explain all the terms clearly to the patient, because you do not want to use medical jargons, right? But after that, then you ask the patient, do you have any, like the wife, do you have any concerns? Okay, just tell me what happened, right? Because that's how you'll be able to know, you obtain the information. You want to know what happened, what what was the preceding event to the seizures. Then after, there are some other things you really want to explore better. Okay, as the wife, are you the next of kin? you know does the patient have a substitute decision maker? Because now the patient is being ventilated, the patient cannot talk, there is a bleed. So when you establish those things, those are some of the ethical issues here that needs to be addressed on time. Once you establish that this is the next of kin, okay, and the patient probably, okay, at that point you are ready to talk to the wife and say, okay, this is the problem at hand now. There is a bleed. It's possible that there the patient doesn't recover, right? But however, there's a way you relate the information to the patient. However, these are some of the things that we want to do. Then at that time, there are some things that you want to talk about, like, okay, while you asked about the preceding events to the seizures, at that point you want to explore that, oh, as your husband had a medical condition before, was he on any medication? Then at that point, we talked about intubation, life support, and all that. Then you talk about other things like your goal of care, what you want to do in this patient's care, right? Does the patient have a written will, any advance directive? Then you want to establish that, because that would inform you about the decision to take in terms of the goal of care for the patient. Some patients will say they don't want to be intubated, they don't want to be placed on life support, they don't want, so those are the steps you want to take while managing the patient. Then you want to ask the patient, because there are some patients that they are organ donors, you want to establish the fact that, okay, um, are they organ donors, Then also, because the woman is agitated, you want to ask, oh, do you have any family members? Do you want us to call in your family members to probably talk to them more about what is going on? The hospital has a chaplain, right? Then as at that time, while you are establishing all these points, you are also asking the patient, do you have any questions, any concerns? Is there any other thing you want me to do? Then, however, in this type of case, you are not the only one managing the patient. So it's always multidisciplinary. So you have other people you want to invite. Do you want us to call the neurosurgeons? Do you want to talk to them, because they'll be able to answer some questions you have? So basically, those are just some of the points that you could have said, and probably it would have elongated our chat, right, to that 8 minutes. So Dr. Becky, yeah, you can go ahead. And I think there's a question in the...
Sorry, before Becky talks, let me just Becky, are you there?
I'm here.
Okay, so I was thinking that maybe we can address this question before you talk.
Sure.
So there was a question from Samina Khan. I hope I'm pronouncing the name correctly. She was asking if we can disclose the patient's condition to the wife from the ethical point of view without knowing if she has the power of attorney. So in a situation like that, it's a very good question because it's something that can easily be tested. It's a component that is actually being tested in this station. So after exchanging pleasantries with the wife of the patient, it's important to ask what the relationship with the husband is. It's very possible that they are already divorced. It's possible that they are separated. And it's also possible that they have cordial relationship and she's the next of kin. So in a situation where they are divorced, it is unlikely that it's okay to discuss such a situation with the wife. But in most cases in the exams, they have cordial relation. They are married. She's the next of kin. She has the power of attorney over him. And just asking about what the relationship between the two of them is at the start of the interview would help establish that. So yes.
All right. Thank you so much, Dr. Odenisi. So
You're welcome.
I think they've said everything. For me, I like to approach my bad news because this is breaking bad news, right? We use spikes when we want to break bad news. So now this is what you should do in every bad news station. Somebody comes in and jumps at you because you don't expect in a bad news station that you're just going to walk in, knock, and the patient will be sitting down. Sometimes they actually jump up and they're like, doctor, what should I do? And you were busy so calm and collected with your pen and paper. And you're like, that's what's going to happen. But if you prepare that there's something surprising behind that door, when the patient just, you go, oh, because there will be a name at the door, right? There will be a name at least of the person you're meeting in the people. Miss Jackson, I can see you're very worried about your husband. Is it okay if we take a seat so we can have a better discussion so I can explain what's happening? And she says, okay, doctor. Then she sits down. Okay, so I am Dr. Omokaro. I'm one of the physicians managing your husband today. So in the next couple of minutes, I'll just need to talk to you about what's going on and find out what you know. Will that be okay? And she says, oh, yes, doctor, that will be okay. I'm like, okay, so tell me, I just want to confirm your husband's name just to make sure that we're giving the information to the right person. You confirm the name, always confirm the name. Oh, my husband's name is Adam Jensen. Oh, I see. Okay, so how much do you know about your husband's situation? Now, we are using spikes, right? Well, it's not, we are going stepwise and we've established the setting. Don't forget, now another important thing is there is a setting here. You want to know, are you here alone? Is there somebody else with you? You want to give someone bad news. You want to know the support system they have. Is there someone else that could be here with you? Is there someone I could call to be with you? Like, unfortunately. So you don't just burst into the news and you now go, how much do you know about your husband's situation? That's perception. How much do you know? Oh, doctor, I was with him. You already know they have a good relationship. Oh, doctor, we were at home together and he just slumped and he fell and he's bleeding. Oh, I see. Anything else? And doctor, I called the ambulance. Then you go into acting. Like Dr. Tunde said, the thing about an OSCE, it is not just a clinical exam. It's a test of your acting skills. How good are you? Because somebody is acting a role. You to get into that role and you're like, oh my goodness, that must have been very distressing for you. Now, there was something Empress said that I think you should not have said. You should never tell any bad news station, anybody going through stress, never tell them, I'm sorry, I wrote it down. You never tell them I know how you feel. Have you ever had someone have a stroke in your family? So you can never know how they feel. Even if you do know, you should just say, I can't imagine how difficult this must be for you. Like, it sounds like you're going through a really tough time. So you don't act like you know what they are going through. You can never know what they are going through. So you can't say, I can imagine what you're going through. You can't imagine, doctor. Doctor, have you had, then they could tell, have you had someone with stroke in your family? And you're like, no, but what? So it is setting. You get a good setting. Look, if we could, let's go back to the Calgary-Cambridge guide. So this is the Calgary-Cambridge guide. Remember, initiating the session, preparation at the door. You've prepared what you want to do. In a real situation, you've set the room, you've turned off your phone, there is no disturbances, right? Then you establish rapport. Oh, Miss Jackson, I am Dr. So, I'm here to help. Can you sit down so we can have a good discussion and understand what's going on? She sits down and you're like, oh, can you tell me what's going on? Or you establish rapport, right? So how can I help you today? Doctor, my husband was in the hospital. He had an accident. Oh, I can see. Is there anything else? So you're identifying the reason for the consultation. Now we gather information. The next step. So tell me, Miss Jensen, how much do you know about your husband's condition? Now, this is where I'm answering Samina's question. Can we disclose the patient's condition? When she already knows everything, what's there to disclose? Right? For her to be there, there will be a way you'll know what is going on in the situation. So if it happens that in the course of this establishing your rapport, you find out that this woman, a woman that is divorced from her husband, will not be concerned in the hospital with him. It will probably be his daughter that is there, and an estranged daughter will not be there. So in the setting and in the rapport, you will find out what's going on. So tell me, what happened? And she says, oh, doctor, we were in the living room and he got up to go get something from the dining table and he slumped and fell. Oh my goodness. So tell me more. What happened next? And she said, well, doctor, I quickly called the ambulance and they came and they rushed him to the hospital. And so far, what has been done for him? Are you noticing that I'm listening to her story? I'm not jumping on her with all my information. I have information. I know what is going on, but I need to know the perception. What does she know? What does she know before I give her information? Now, when I have identified all the things she knows, or be like, oh, he's slumped. Has he had something like this before? Does he have a history of high blood pressure? Is this the first time he's coming to the hospital? Give her room to talk. Then you invite her with the information and say, is there any part of your setting? Is there anybody else that I could call? Is there anybody else with you in the hospital today? You want to give her some support. Would you like me to call someone to be with you? She says, no, doctor, I'm fine. You should always check your setting. Then you go into, all right, you don't just go, well, your husband had a stroke. You go, well, Miss Jensen, you should put an intro before the bad news. You go, unfortunately, I do not have good news today. Then you pause. Doctor, what do you mean? You don't just go, there's an importance of a pause in every bad news station. So unfortunately, I do not have good news for you today. A pause. What do you mean, doctor? So when your husband was brought in, this is what we've done. He was taken to the CT scan. We found out that there was a bleeding in his brain. And based on this, right now he's unable to breathe on his own. We have to put in the chest tube. We have to do this and do that. Then you tell her what you know about the condition, right? Then the next thing is, well, usually when we're taking care of patients like this, we are going into goals of care now. You've given her the knowledge, right? We've done the spike. We've invited her for the knowledge. Now we've given knowledge. Now we're entering goals of care, because when a patient is going to die, we have to know goals of care. Say, so Ms. Jensen, has your husband ever discussed anything about his wishes? If there's a time he's unable to breathe, or what if there's a time his heart stops? Then that is there. Then that is when you do all the goals of care. Is there someone else? Does your husband have someone like a substitute decision maker? Like, what is a substitute decision maker? Oh, by that I mean when your husband appointed someone to make decisions for him when he's unable to make decisions himself. So you do the goals of care. And by the time then she'll be like, I know this is a lot. So whenever you're breaking the bad news, you have to pause. You're not like, I know this is a lot for you to take in right now. You see, I am Dr. Omokaro. I'm still in the hospital. If you have any question at any time, don't hesitate to reach out to me. I'm here to support you. I'm here to help you. Are you feeling good the way I'm talking to you? I need to see something in the chat room. So Empress is saying all these questions. It's not a question. Mind you, counseling stations they are full stations. They are like 10-minute stations if it's a NACOSP station. In the QE2, you actually have like 15 minutes to interact. So tell me, what will you be doing in those 15 minutes? If you're not making sure you're getting a good history, you're not making sure you're giving good advice, right? That is what you should be doing. Yes, thank you, Samina. Thank you, Notes. Yes. Yeah, so you are acting like, when I was doing my QE2, it was almost like I was feeling the patient's pain. I was like, this must be so difficult for you. Like, I can't imagine what you're going through. You know, you are acting. Never forget you're an actor. The way that patient, the SP is acting, you are also an actor. So when you finish, you're like, you're really like right now, this is like, doctor, what's going to happen to my husband? Like, I can assure, like, at this point, I can assure you, your husband is in the best of hands. We have the best doctor in the hospital, even though he's not the best. It's not a lie, but say something. Like, your husband is with the best brain surgeon in the hospital. They are right now talking with the best nurses. You know, I'm part of a team, and all of us are putting our heads together to give your husband the best care possible. And if there's any point in time you have a question, don't hesitate to reach out. We are here to help. We are here to support you. You only have to, we're just a call away, you know. Put our mind at ease. At this point, do you have any question for me? Okay, so I can give you some leaflets about this condition, like it could help you better understand. And I know this is a lot of information to take in, so you might need some time to process this, right? So reach out. Let's say, for example, the person has cancer. You just told the person he has cancer, or he or she has cancer, and the person is going on. You're like, you know, you might have questions. Your family might have questions. You can always come back to the clinic to see me. Bring your questions. You can come with your husband. I can help you break the news if it's very difficult to tell him. Let's work together. I'm always here to support you. You're going to be navigating a lot of steps. I will be your primary contact to support you in all of this. That is counseling. That is breaking bad news, right? It's going to be pretty long. So at this point, we will close the class. There is no more time to take a second case. So I'll just end the class by saying why you should take an OSCE Prep course. And that means in everything you need to do in life, you can learn either by trial and failure approach, which takes time and effort, or you can learn from someone who has done it before and save your time, the expensive fees and of the exams if you should risk failing, right? So you can learn from Dr. HealthThenMore. I will show you the whole balanced approach. So what are the modules we'll cover in the tutorials? We're going to cover an introduction to the OSCE, a guide to patient-centered care, OSCE exam success techniques, tips and strategies, history-taking structure for the different specialties, and how to do it effectively. Physical examination. Look, people go into the exam and they just go touch and say, on examination, the lump is this. That is not how to do the examination in the Canadian OSCE or any OSCE at all. You need to let them know what you're doing, how you're doing it, and what you're finding. So it's a 3-step. It's not just the 1 step. So we'll show you all of that. I'll be teaching how to interpret x-rays and common ECG strips, medical ethics, and how to resolve complaints. What if a patient comes and says, oh, doctor, they lost my sample bottle. The doctor that I saw last night, my son had a broken leg and the doctor didn't do the right thing. So how do you resolve complaints? How do you counsel and break bad news? How do you communicate with difficult patients, dealing with teenagers, clerking, and management of common cases, and we'll do an online mock, something like this, just to show you where you're still weak. So finally, I think that brings us to the end of the class. If you really enjoyed the class and you'd like to be part of any other class, you should leave a very good review for me with your social media handle and send me a picture of it to my email address, and I'll consider you for another class. Thank you to all my co-facilitators. Thank you to the all of you that listen, all the doctors. So let's have a little chat. I'm going to ask to unmute everybody so you can ask your verbal questions and we can close the session. So let me unmute everybody. I think I've asked Zita to unmute, Ebin to unmute, Samina to unmute, Note, Justin, Ijoma, another Note, Ayodele, Zita is on mute. Okay, so I think we should use our voices at this point. We've come to the end of the class.
Okay. All right.
Oh yeah, thank you very much. Thank you, everyone. Thank you, Becky. Thank you.
Thank you so much, Dr. Tunde. So for the participants, please, can we have your input?
Okay. This is Empress speaking.
Okay.
Thank you very much. I really enjoyed the session, and it actually puts me in the right mood and the right frame of mind towards the exams. And I applaud you and all the facilitators for doing such a wonderful job. Not every one of us are able to get the money and go and pay one academy at this point in time, especially, and it's really wonderful to have Nigerians are known to have this giving spirit, and it's really good to know that even after we left home, our culture still remains with us. We are ready to help ourselves as much as possible. You can help, Dr. HealthThenMore can decide that, okay, I want to make money out of this. And yeah, some people don't have a choice. We have to go along with you. But considering that some of us we can't even meet, I can't meet up with the prices for any academy at this point. So I'm really very grateful. And this is a very great eye opener for me. I intend to do the OSCE at the end of the year, but I don't know. I still have Q1 in front of me first. So thank you so much, and I'm very grateful. I want to be in the next class. And when are you going to have a run through for Q1 and all that?
Okay.
Thank you very much. I thought that was a very rich section.
You like the session?
I'm really grateful for your time. Yes, I really enjoyed myself. I loved your approach, your confidence and everything. It's quite infectious. I thought that was very nice, really, and encouraging. I'm really inspired by this. Keep up the good job, right? I'm going to give my
Are you
review.
from Doctor's Pathway?
Yes.
Then go to Doctor's Pathway. Put it in Doctor's Pathway. The one.
Okay, okay, that's good. Now it's easy for me.
Doctor's Pathway. That you were at that tutorial. It was amazing.
It was too much.
Okay.
Yes, Ayodele said I will leave a good review. Mary S said yes. Okay, who else is going to leave a good review? If you want to be part of another class, trust me. I did all my QE1 class, as in all my MCQ in one attempt. So I can definitely show you how to approach your MCQ. So if you want to get QE1 class or any other class, you need to leave a good review. Yes. Thank you so much,
Dr. HealthThenMore.
Dr. Dr. Kumi, Dr. Tunde. You guys are just like the best support system ever.
All right. Thank you. We'll see you again. Take care.
Bye.
Bye.
Thank you, Dr. Ajayi. Thank you, Dr. Dr. Weber. Bye-bye.
Thank you so much. Bye.
Bye.